Let's talk about period poverty. Topic outline is first introduction to the menstrual cycle, then debunking myths and taboos about periods, and last is a global period poverty. First is a introduction to the menstrual cycle. What is the menstrual cycle? First, menstrual cycle is also known as a periods. It is the regular discharge of the bloods and mucosal tissue from inner lining of the uterus through the vagina. The menstrual cycle is characterized by the rise and fall of the hormone like estrogens and progesterones. What is the menstrual cycle? Menstrual cycle is a mainly three phases. First, menstrual phases means menses phases. Second is the follicular phases. It consider also ovulation, and last one is a luteal phases. What is the menstrual phases? This phase begin on the first day of period to the 3 or 5 to 7 days. Then follicular phases. This phase begin on the day of get your periods and end of the ovulations. What is the ovulations? Ovulation is the phase occur roughly at about day 14 in a 28-day menstrual cycles, and then luteal phases. These phases last from about day 15 to day 28. Then we see dysmenorrhea. What is the dysmenorrhea? Dysmenorrhea is the medical term for painful menstrual periods. It happens because your uterus contracts to shed its lining. The pain typically begins just before your period and subsides after a few days. In addition to cramping, you might have other symptoms such as nausea, fatigue, and diarrhea. What is the period struggle? We all know period struggle during periods, lower abdominal pain, lower abdominal cramping, also weakness, tired feeling, cannot relieve any positions, nausea, anorexia, headache, etc. etc. Then we see debunking myths and taboos about periods. First, myths. Women shed impure blood during periods. Many of people says around us that women shed impure blood during periods. But no, menstrual cycle is a part of woman reproductive system that prepare her body for possible pregnancy. The menstrual blood is also the same blood that circulates throughout our body. When cut our fingers and then we can see red color fluid is coming out. Then why is our period is impure? Second is you shouldn't wash your hair during your periods. Also, I have experience someone ladies is talking regarding this that during period you cannot wash your hair, but fact is you don't need to compromise your personal hygiene habitat due to your periods. There is no study in the state one that one cannot wash your hair and take a shower on your periods. In fact, a warm bath can help you with the painful cramps during periods. Our personal hygiene is more important. Then, what is the debunking taboos? First, that is across our culture, a perceived might suggest that menstruating women are impure or unclean. This belief has resulted in the segregations of women during their menstrual cycles, limiting their participation in religious activity like pujas, etc., and isolating them from social setting. The first is this myths is debunking from our societies. What about periods? Discuss period openly without the shame. Like Why? The simplest action a person can take a end a period stigma is to not to take a part in discussing it vulgarly. By speaking about any topics openly, we help to remove the socialite rule against discussing it. We all say that some people see just feel like it is a shameful, but no, it is not a shameful, and that people discuss vulgarly. But when we discuss periods is a part of our system, part of our life, is openly to the all people without shame, then this taboos like perseverance might suggest menstruating period are impure, unclean, is a debunking. Then what is a global period poverty? What is a period poverty? Period poverty is a lack of access to menstrual product, educations, hygienes, facility is, and then waste management or combination of this. Many of people we are say around us that we are not able to purchase period pads or their access. So this called as period poverty. How many people suffer from this poverty? Globally estimated 500 million trusted source people who are menstruate lack access to the menstrual product and hygiene facility. Effect of the period poverty. What is the effect? Period poverty lead to the health risk, hamper educations and limit opportunity for women and girls, perpetuating a gender inequality. Then only 30% of Indian girls are aware of menstruations prior to the menarche. 60% of the girl miss school because of the menstruations. Then 79% faces low level of the confidence because of the menstruations, and 44% felt humiliated and embarrassed over the restrictions. Blood has no gender. What we can do? First, in South India, we show that first menstruation where they are celebrate. So we also accept and celebrate our first period. Then ask questions and interact with our family members. Then track your menstrual cycle, monitoring and records with wrap period pad and tampon in a waste paper or paper bag. Then we all say, my body, my choice. Conclusions: menstrual hygiene, a very important risk factor to reproductive tract infections, is a vital aspect of the health education.